I just want to make sure that I have permission to video record you for my class.
Yes.
Okay. What do you think that you can do in your leadership role to empower others?
Help. I like to help my staff grow and succeed. And you know, if they don't know how to do something, to educate them and to be right there with them at their side to show them how to do it, and to do it correctly. I like to give them a lot of positive feedback. Yeah, you did a good job. Um, and a lot of constructive feedback. Um, but most of all, you know, I like to make sure that they feel good at what they are doing, and if they don't know how to do something, I want them to feel like they can come to me and ask me, you know, hey, look, I don't know how to do this. Would you mind going with me and showing me? And to me, that to make the nurses feel better, I go and show them how to do that.
Okay. What are your personal leadership strengths?
Um, I like to um, I like to work with the staff to make sure that they accomplish their goals. Um, and I am very strong at educating the staff, especially when they don't know policy and procedure and how things get done, um, and to make sure that, you know, if they need more education, especially with IVs or um, wounds or anything, I always make sure that I get them some education for that.
Now, would you say that, as with your strength as a leader, that you would help family, your staff, be able to deal with a difficult situation as in patients' families? Showing them ways. What I mean is, like, how do you help them? Show them ways to deal with, like, a family that say it's a little bit difficult, like, in a sense, instead of, in a sense, like a family that's difficult with to deal with. They are, no matter what you do, it never seems right. And if, say, a nurse would come to you, do you find it easy to help the staff nurse deal with that patient and their family?
I usually try to go and talk to the family if there's an issue with a staff member that may have issues with the family, and try to talk to the nurse to find out what we can do to fix that situation, and also talk to the family member, come to a compromise, and try to figure out how the best way is to fix it.
Um, how do you handle suggestions and feedback when negotiating changes and improvement?
Um, well, when there's a lot of changes going on, I try to do a lot of in-services, and I try to talk to different staff members just to get some insight on how they think things should either be changed or how to try to fix something. And then just try to come up with the best way how to fix it.
Um, Now, obviously, as a supervisor on this unit, you have your own boss. How do you deal with her feedback when it comes to the way unit should run, since she isn't a nurse that works on the floor and might not necessarily understand how it is day to day on the unit? Meaning, like, give an example. How you handle a situation. She always is giving you feedback or discussing how things
Depending on how depending on what it is that has happened, usually my boss will say, hey, look, you could have handled it this way, or you could have handled it that way. She's always giving me feedback on a different way of handling, say, a situation that maybe a staff member felt that I yelled at them or whatever. and she, well, you could have handled it this way, instead of, and just making sure that, you can't say certain things. You have to make sure that being a supervisor and in a leadership role, try to keep your whole attitude and demeanor to yourself, and concentrate on what's going on, what happened between whatever staff member or family member or whatever. But she's always giving me feedback, and I try to learn from that.
Because as your leader, she's always trying to apply the diplomatic approach, and teaches the leaders that are under her to follow suit. Is what
Correct.
you're saying.
And to make sure that I follow, policy and procedure on how things get done, and also to make sure that that I'm want a good leadership as well, because I fall into that same category as she does. So
now, when you talked about these in-services, can you talk a little about what they entail? How do you go about creating the in-service to provide education to the staff members under you?
When I do in-services for the staff, if something happened with either a family member, patient, or a staff member that doesn't know how to do something, or this is how things, how the unit is run, and this is how things go. I usually go over the policy and procedure. I pull that off the computer, and then I do my in-service. I do education with the staff and have them to sign for the proof that I did give the education, and kind of give them like a little pamphlet type thing of this is how things is run basically by this facility and corporation.
Now, in-services can include, what range of in-services do you do? Do they always include medication, drugs? What kind of in-services do you provide?
I do education like from medications, like narcotic counts, making sure that they're given the correct medication, making sure they're giving a routine and not a PRN when the order is for a routine. I also do measuring for the liquid morphine, just to make sure that they know how to do that correctly. I also do in-services on fire drills. I also do education on for the GNA staff, for the nursing assistant staff, for their ADLs, and how that gets documented. I also do a lot of in-services on PPDs and flu vaccines and all of that, just to make sure that that's being done on admission. I also do nursing education for anything that comes out new that the nurse educator gives me to do.
All right. Thank you for your time. Is there any words of advice that you would give to people looking to go into the leadership role?
Well, of course, I'm always learning, because everything that, every day there's something new. I learn something every single day. And if there's a change in the policy and procedure or whatever, I like to do in-services and stuff with the staff to say, hey, look, this has changed, that's changed. Especially like IVs, wound care, and all of that. And if you're planning on getting into leadership, you have to learn to be able to do a whole lot of things, especially as a supervisor. always try to keep your cool. Sometimes that doesn't always happen, but you really have to try to keep your cool. Handle whatever situation goes on. And just educate the staff and educate yourself.
All right. Thank you very much for your time and cooperation in this.